Welcome everyone to this World Data Forum session on vulnerable children missing in data. We're thrilled that you are able to join us for this session. I'm Kate Richards, Outreach Manager for the Inclusive Data Charter, an initiative hosted by the Global Partnership for Sustainable Development Data that mobilizes and supports action on inclusive data to advance the Leave No One Behind agenda. I'll be moderating this important session today.
Hi, I'm Lisette Flamings. I am the Head of Advocacy and Research at the Consortium for Street Children. The Consortium for Street Children is a global network of over 170 organizations, practitioners and researchers around the world promoting the rights and well-being of street-connected children.
I'm Chris Cuthbert. I'm Director of Research at the Lumos Foundation. Lumos is an international NGO committed to ending the institutionalization of children so that every child around the world can enjoy the right to grow up in a safe and loving family.
Hi, I'm Crystal Casapa. I'm the Research Manager at the Internal Displacement Monitoring Center. IDMC is the world's organization mandated to monitor internal displacement worldwide in context of conflict, violence, and disasters.
No one actually knows how many street-connected children there are in the world or in any individual country. Households on the streets or in informal settlements often fall outside the definition of a household that is used in most household surveys. And being excluded by omission from survey data means that they're not taken into consideration in national and international decision-making, which leads to programs that leaves behind the most vulnerable children. The data that is available on street-connected children is outdated and inaccurate, with biased data continuously reproduced. This includes data on the number of street-connected children in the world. Outdated estimates from the past decades range between 10 to 15 million and 100 to 150 million street-connected children globally. Estimates differ so wildly because they're based on different definitions of who should be included in counting street-connected children, and different methods are used for collecting and analyzing the data.
Children in institutions are very often invisible in the data and off the radar of policymakers. A recent study published in Lancet Child and Adolescent Health by Dr. Chris Desmond and Chungling Liu at Harvard University provides the most systematic picture to date of what we know and crucially don't know about the scale of child institutionalization around the world. They reported a median estimate of 5.4 million children worldwide living in institutions, but the true scale of the problem could be even higher due to poor or no data in many parts of the world.
Data on internal displacement in general is lacking. This can be the result of limited statistical resources in affected countries, difficulties of access to the displaced population, lack of political will to address internal displacement. The current figure of 21.3 million under the age of 18 at the end of 2019 is likely underestimated. Data on IDPs in disaster settings only exists for 7% of the disasters that IDMC monitored in 2019.
Basic services such as healthcare and education are often not accessible for street-connected children, and they are hardly ever accounted for in social protection systems or prioritized in public decision-making. For example, when we say that 91% of children are currently enrolled in primary school, or even when we talk about the 260 million children out of school today, street-connected children are not part of these figures, not even in the numbers that are out of school. They remain invisible altogether. Without data, we are unable to plan for them and their unique needs. They're simply left behind.
Professor Van Eysendorn and colleagues meticulously describe the adverse effects of institutionalization across multiple domains of child development. Living in institutions can cast a long shadow on children's development, yet this group of children remains invisible to many of the governments responsible for their welfare and largely off the radar of the international development agenda. Good data matters. When children are counted, they are more likely to be included in government programs, ensuring they grow up healthy, safe, and better prepared to contribute to society. Good data matters for accountability. Until we shine a light on the issue, violations of children's rights will persist.
Not knowing how many children in internal displacement require support, where they are, and what they need and want is a key challenge when planning aid. If their number is underestimated, the funds appealed to support them also be underestimated.
Typical national data collection mechanisms, such as household surveys and censuses, are tailored to fixed populations living in traditional household structures, and so do not take into account street-connected children or other populations that live outside these formal household structures.
The lack of a globally agreed definition of institutional care really inhibits our ability to generate comparisons between different countries and to be able to track progress in care reform over the course of time.
Studies have shown that if the sampling method and the mapping listing protocols are more inclusive of non-traditional households, for instance those that are street-based, then often the significant time between the mapping listing activity and the interviews in household surveys means that mobile and vulnerable households are more likely to be counted as non-responders.
A real barrier in terms of statistical capabilities, the lack of disaggregated data that allows us to understand the characteristics of children, whether that's age, gender, ethnicity, or other really important characteristics about the profile of the children.
Difficulties of access to areas affected by internal displacement often means that the number of IDPs is estimated based on housing destruction levels or satellite images of abandoned areas. When data collectors are able to meet with IDPs, they often speak to adult key informants or heads of households, obtaining useful information at the community or household level, but rarely focusing on the individual level and on children especially.
The pandemic has given a stark reminder of the impact of exclusion from data. Aid and support schemes have often been linked to official registers and identity documents. As many street-connected children don't have these and are unregistered, they're invisible in administrative data, which means they have not been able to access this relief.
The global pandemic creates additional challenges and pressures for children in institutions and those on the edge of care. The illness or loss of a caregiver, the poverty that follows loss of a job, stress on families, increased conflict, domestic abuse and tensions all really take their toll on family life and are increasing the pressures on the child protection systems right around the world.
With the world focused on developing a vaccine against COVID-19, inclusion of street-connected children in data on vaccination coverage will be crucial in stemming the spread of the virus.
Internally displaced children are often more vulnerable than non-displaced children to dropping out of school, achieving lower levels of schooling, and receiving lower quality of education. The widespread school closures that resulted from the pandemic could very well be the tipping point for these children, forcing them out of the educational system altogether and pushing them even further behind, where getting back to school will become impossible, is likely to force more internally displaced children into child labor, early marriage, or other harmful practices than ever before.
If these children are not to be disadvantaged even further by the pandemic, we need to make sure that robust and reliable data is collected so that we understand how they're being affected and what support they need.
In this next section of the event, we'll focus on how better data can be generated and the key steps we need to take national and global level action. First off, I'd love to hear about any examples from the panelists' work where data collection is being inclusive of these groups of children and kind of what some of the impacts of that has been, what are some of the lessons that have emerged.
We've had lots of experience of working to capture really good quality research data in contexts as diverse as, you know, Karelia in northern Russia or Malaysia or Haiti post earthquake, and we've found it is possible to work really closely with partners on the ground to really understand and capture good quality data about the children living in those institutions. But of course, the real challenge is about how we get good quality national level data that can help governments to plan, and UNICEF has taken a real lead in some countries in terms of trying to find ways to overcome the barriers to data collection. So their work in places like Ghana, supporting capacity building of national statistical agencies. And their aspiration is to develop a standard protocol that can support more consistent data in other countries around the world. So some welcome developments, but at the moment we still face some real challenges in trying to understand the global picture and the state of progress.
Definitely. Thank you very much. I think it's interesting to hear how there are, other actors also making good progress in this space. Crystal, I know that your organization has also been focusing more on some of the direct collection of this data and disaggregation by age and other dimensions.
We have indeed recently invested in primary data collection. It is helping us bridge a massive knowledge gap. It is pointing us to some directions where more research is needed, but it's still not enough. It is essential that children, and especially when they're a little bit older, young people, be involved themselves, not only in the answers that are given, but also sometimes in the data collection itself. And some organizations are doing this. I'm thinking in particular of our partner, Plan International, who just conducted very interesting surveys of young people internally displaced. And they also engage with young people in the local non-displaced community to hear the thoughts of non-displaced youth on the displaced youth that they were living with. So that's really a great example.
Yeah, I think it's really important that the children themselves, that they are included when data collection takes place, because they are, in fact, the experts on their own lives. They know best what is important to them, what their needs are. The Growing Up on the Streets project, initiated and carried out by the University of Dundee and Street Invest, where street-connected children and street workers were trained to collect data, and the street children themselves actually identified what were the most important aspects of their lives, and then the data analysis was based around those elements. And that gives us really rich, in-depth, qualitative information on the realities of these children. Often this kind of qualitative data doesn't then show up in the national data and statistics that are actually being used to inform government policies, which is why these children still remain so incredibly invisible.
All of you have mentioned different organizations that are also working in the space. And I think one of the most important things is about how learnings are transferred and how kind of as data sets maybe become available, how those are put into use and how we are highlighting those cross-sectoral learnings or working more closely with a government, other NGOs, the multilaterals and UN agencies to work together to enact some policy change or encourage action through better data.
There are definitely examples that we have seen from our network members who are working in country to really inform government policy and work closely with governmental authorities to create a better picture of street-connected children in the country, and estimation and survey exercises to get a better idea of even just how many street children there are in a specific context. Often these are citywide counts, but there have also been national efforts, and often what we see what has been most effective is when organizations work together with the national statistical institution, for instance, in a country, and with government authorities from the very beginning to set up the methodology together and to carry it out together so that by the end of it, these are statistics or estimations that the government then has faith in and feels comfortable working with.
I would build on that and really say I think it's essential that we have this kind of partnership between NGOs working to champion the needs of these vulnerable groups of children and official agencies. It's only really when we get that full picture of the whole range of different needs, how the system operates, how policies operate on the ground, that you can really get sustainable change to improve the lives of children. So For me, the questions that we start with around prevalence and the scale of the issue are just the beginning. We then need to get much deeper understanding of what's actually driving the vulnerability we're trying to address. What are the opportunities for prevention? And often the economic questions are neglected here, the resources that are needed to be able to fund prevention. These data questions are actually part of a very broad research agenda. They're a part of a broader need to understand the systems that perpetuate vulnerability. And as Lisette said, actually understanding what that looks and feels like from children's own perspectives is central to be able to design and develop policy solutions. And if government is part of that inquiry, if government's alongside NGOs and others as we're trying to understand those problems, we're trying to unearth what's happening, they're much more likely to have a stake in policy reform and changes.
All these issues are, data is one component of them, and it's such an underlying important, component of any change, of actually being able to initiate a focus on a specific group of people towards actually knowing what works to serve them. But it is also, you need to have the broader policy involvement, you need to have that political will behind it. And that's something really that I think the Inclusive Data Charter is very much about. And I know that IDMC and CSC are both part of that. And so we work a lot to kind of forge those connections across different organizations. I wanted to pick up on one of the points, Chris, that you mentioned, and I know that everyone here has been focusing on common definitions, common methodologies to compare within a country. And then obviously the aim longer term is to be able to compare across countries and have a better global view.
Being able to aggregate and build up that global picture is hugely challenging when different studies, different official agencies differ in what they're including in the way in which they're looking at institutional care. So a really important piece of the puzzle moving forward is to get a definition everybody can sign up to. It may be that people want to measure other things on top of that core definition, but it's really going to be crucial for us to be able to compare between different contexts, but also to track over time in a way that allows us to understand what progress is being made.
Yeah, I would say it is one of the biggest challenges in collecting data on street-connected children. We talk about children living on the street, children working on the streets, children who may have a home to go back to, but spend a lot of time on the streets. Like, how do you define a group that's so diverse and has such different lived experiences? So far, that is one of the major challenges that we see in the data collection, is that the efforts that are being undertaken, they all use very different definitions, and it makes it completely impossible to kind of compare the data that comes out of it. And even over time, if you do it in the same context, the risk is that if you start agreeing on a common definition, is that you start excluding certain groups that may, be more difficult to really have a set definition that can be used globally. So there is definitely a difficult conversation, but a conversation that needs to be had between different actors working in the sector.
In the case of internal displacement, there is actually a definition that's been globally recognized and widely accepted. Which is that anyone who's been forced to leave their home for reasons out of their control and do not cross a border are internally displaced. But actually, there are so many countries that understand this definition differently. We have countries where people who are displaced by disasters are not defined as displaced, whereas people who are displaced by a conflict or violence are. That doesn't mean that the government overlooks them or does not support them, but simply they're not defined as IDPs. So yeah, it is actually not so straightforward. And then we have such a variety of actors working with the people who are displaced and collecting data on them, but for various purposes. For their own purpose, if they're working on education, it will be focused on education data. If they're working on health, then it will be focused on health. If they're providing cash grants, that again, the data that they collect will be different. So there is data, actually, at least in the case of internally displaced children, there is quite a lot of information available. But the question really is about, yes, agreeing to definitions and then identifying this data as relating to internally displaced children.
It's really interesting here how, you know, you've then had the challenges, you agree a definition, but then how do you actually operationalize that? How do you make that be implemented on the ground? And some of these different fora seem like really interesting ways and promising ways in which you can drive some of that consistency and quality in the work that you're doing, Christelle.
So looking ahead, I'd like to hear from each of you on what you think the 2 or 3 big things that need to happen to improve data for each of the groups you work with is. Christelle, I'll start with you.
To collect more data directly from children and young people. We're investing in the coming months in more studies that will this time include more focused discussions with children and young people and investigate a bit more in depth, especially the relationship to education and how they're able to access quality education in spite of displacement. So that would be the first step at a sort of local level, primary data collection level. But then I still think there are lots of efforts to be made when it comes to awareness raising. At IDMC, we have a global mandate, so we very often focus on global level political forums, such as the United Nations. We are part of the high level panel on internal displacement. Our director is a member of their advisory group, and through this forum, we are able to share some good information, new information, estimates on the number of children worldwide, estimates on the cost of addressing their needs as well, because we have to be blunt and it's very often about money. So if we can get this kind of information on what would be needed to address the issue, that could raise a lot of attention and hopefully also trigger some action. So we will be investing in these 2 levels, mainly global or national level awareness raising, encouraging political will and investments in the issue, and also starting with ourselves, collecting better data at a more local level.
There's kind of 2 sides of what's needed. There's the technical side, where there's a real need to improve methods, agree on definitions. If we're talking about street-connected children, if we want to improve, for instance, existing methods like household surveys, mix and all of those, then it's really important that we broaden the definition of what is a household so that we don't just focus on traditional households, but also, for instance, the time between mapping listing and actually doing the surveys is as short as possible, so that for mobile populations, that there is more accurate data. There are various different ways in which existing survey methods could be made more inclusive of vulnerable population groups by adjusting some of these elements of the data collection methods. Even if these survey methods become more inclusive, the likelihood of vulnerable population being included in that, the number of them being included will likely still be so low that disaggregation of data based on age, based on sex, based on many different factors will likely still be impossible, making it really difficult to really say something meaningful about them in the data that can then inform government policies and programs. And then on the other side of that is that even if we make survey methods available and more inclusive, they wouldn't really have an impact without government commitments to actually including this data in their decision making. What we see a lot at the moment is that, for instance, for the Sustainable Development Goals, how data is being collected for that is mostly through household surveys, and a lot of population groups are excluded from this data. So even when we talk about progress against the Sustainable Development Goals and leave no one behind, actually we are leaving a lot of vulnerable groups behind simply because they're not in the data, because of how it's collected. So I think there needs to be a real commitment among the global development sector, but also among governments, to really make sure that the evidence that they're using to develop policies and programs, that's inclusive of the most vulnerable population groups. And this may mean that they need to also take into consideration much more qualitative data that does exist about these groups, rather than just relying on kind of national formal statistics, working more with NGOs and other practitioners that do have a lot of qualitative data about these population groups that actually give really valuable insight into the lived realities and the needs of these groups that can greatly inform policies and programs so that it can actually address their needs.
In terms of children in institutional care, there are 3 key actions. The first, you won't be surprised to hear, is about definitions. We need to agree standard global definitions of institutional care so that we can get consistent, high quality data routinely gathered and make sure it's possible to disaggregate that data. Secondly, capacity building. We need to invest in capacity building to ensure that national statistical offices and agencies have the capability to regularly count children in institutions in all countries, and in particularly in low-income countries and countries where institutions are often unregistered and in the informal private sector. And then thirdly, tracking progress. For children in institutional care, we really need to invest in systems for pulling together the global picture so we can see the numbers across different countries, and crucially that we can track progress and see how care reform is shaping up over the course of time.
Thank you. I think there's some clear kind of national and global priorities there. And hopefully some of the participants at the World Data Forum are the people that need to take this action and are able to join this session. And as a reminder, we'll be hosting a live Q&A with the participants here and anyone else that would like to join us on the 15th of October at 2 p.m. UK time. And that's an opportunity to kind of share your experiences as well as to ask questions. We appreciate you for taking the time to listen to the session, and please leave any comments or questions in the chat box next to this video.